Along with my colleagues Chris Jallian and Ray Jallian, we recently completed a review of laser litigation in the United States of America between 1985 and 2011. And what we found is that the three most common reasons for lawsuits involving laser is number one, laser hair removal, number two, photo rejuvenation, and number three, treatment of vascular lesions. Now, the two most common reasons for lawsuits were malpractice, which is a failure to provide a reasonable duty of care to a patient leading to harm, or secondly, failure to obtain informed consent. Those are the written consent forms. Now, it's important to realize that there's a very crucial distinction between malpractice and a consent action. A malpractice action alleges that there is a failure to provide reasonable duty to the patient that resulted in harm. Consent is the requirement to give an informed consent prior to a procedure. That's what the written consents are for. Now, these cases vary geographically. They were most common in California, New York, and Texas, and the amount of awards ranged anywhere from $5,000 to over $2 million for a wrongful death procedure. I think the important take-home point from this is, number one, that there is laser litigation out there and it is increasing with time. The other thing is, to the extent that you use physician extenders for laser cases, the employer of the physician extender, who is typically a physician, is liable for the malpractice committed by the physician extender so long as the physician extender works under the employ of the physician. And so this is something that has continued to develop over time and has increased over time. It is important to look at the law of informed consent and malpractice.